Have you noticed more men starting to care about their skin, their hair, or just how they're aging overall? But they really don't know where to start. A lot of men are interested in looking a little more rested, a little more put together, but they don't necessarily want anything obvious or overdone. Today, we're talking about what men are actually coming in for, what treatments make sense for them, and how to approach this in a way that still feels natural and feels like you. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. Today, I'm here talking about rejuvenation for men, procedures for men, why they're coming in, and what we can do. And I brought in Alexxa Forte, our cosmetic consultant that helps me consult with, educate, and come up with treatment plans for the growing population of men that are coming in looking for rejuvenating treatments. So, Alexxa, let's start by, what are you hearing? You meet with the patient before I do, and I hear it too, but tell me all that you're hearing and what men are wanting.
I feel men, just like women, they want to feel good. They want to feel relevant. They're always saying, I feel like I look really tired. And I think a lot of men we see, correct me if I'm wrong, Dr. Rostan, they feel like they're working very late. So I feel that's where their tiredness appearance is coming from. We even have dads with younger children that come in and say, I want to look the way that I feel.
Yeah, the I don't want to look like the old dad.
Yeah.
I hear that a lot. I want to look the way that I feel. I feel great. I want to keep working, but I want to feel relevant at work. I don't look like I used to, right? They don't really know what to do. Now, the reality is we've been taking care of men for a long time and producing very beautiful, natural-looking results. You have to respect the manly aesthetic, but you can still restore. You can still rejuvenate and repair. What are some of the concerns you hear from men? I know I hear them, but they might tell you things that they don't tell me. What kinds of things are you hearing even
All of
before
the
I come
things.
in the room?
I look really tired, or I'm dating and I need to look good. I'm working out all of the time and I want my face to match my body. We're going into warmer months. Or my wife looks really great and I want to look as great as I feel she does.
Yeah, wives do look great. I'll give them that. That'd be hard to live with.
Yeah.
Poor Robert Rostan.
I know. No.
No. I hear from men, not too much. I don't want to look done.
Oh, right.
I don't want to look overdone. I'm like, we got a long way to go, bud. We're good. We're in the safe zone.
Or I don't want to look feminine.
Absolutely. Now, we are living in a world of some transgenderism, and we do treat those patients. I will sometimes ask, do you wish to look more masculine or feminine? But we're talking about the men that come in that are wanting to regain masculinity and a youthful look. I promise you we can do it very easily. Men do great. And then that's usually what I say to them. I'm like, Are you kidding me? Men heal up from these lasers like nothing. Men do great with brow Botox. Men do great with filler. Their skin's a little thicker. You'll never see well-placed filler. I have seen some bad placed filler and taken it out. Men do great. So I do a lot of reassurance. Number one, it's okay that you're here. Number 2, you're going to be just fine. Number 3, it's not going to hurt. And number 4, no one's going to know you had anything done. You're just going to look better. Do you agree?
I totally agree.
Yeah.
And I think they really respect Dr. Rostan in the room when she's going through. And we treat a lot of male patients. I think we also bring that up. You just mentioned that. And we have a lot of before and after photos of men, which creates that comfort in the
Comfort zone.
consultation.
I also tell them something that I think surprises them is if we rejuvenate your skin, if we get you on a good skincare plan, maybe do some rejuvenating laser treatments, we're making your skin healthier. And that's important. We've actually started seeing a lot of dermatology referrals of men, and they're having a lot of skin cancers, pre-cancers. And when they come in for these laser treatments, we're making their skin healthier, more resilient, more resistant to the precancers. It can treat the precancers, reduce the risk of skin cancer. So it is not just a vanity thing, at least in my mind, and I try to educate my patients on that. I'm like, well, that's great, but we're going to make you have healthier skin as well. And it's just nice they come in and we can tell them about a great sunblock that won't run into their eyes when they play golf. Well, Alexxa, let's break it down and let's share with our audience what men are really getting done.
Tell us what you recommended for Shep when he was here.
Shep has great looking, youthful skin, great structure. Obviously, he's on TV. And he had an event that weekend. So I recommended for him a facial. A pore cleansing facial is always very good before an event. And frankly, good for anyone that is in front of the camera because you don't want clogged pores and things like that. When we do that, you get exfoliation of the upper layer of skin, and that can be followed with a laser facial. And a laser facial is actually a laser treatment, but it's low energy, no downtime, no pain. It restores the glow to your skin. It builds collagen. The reason for doing it after a chemical peel or facial is that the upper layer of skin is reduced in that chemical peel or facial, and more of the laser energy gets down into the skin. So the upper layer of skin can deflect some of the laser energy, but when we've got a hydrated, smooth upper layer of skin that we achieve with hydrofacial, Glow 2, chemical peel, steaming, more of that laser energy gets in the skin. So I think Shep had a big time getting that done. I think he looked great for his event. I don't know if he had a filming after that, but I'm sure he looked good for that. So that's very approachable. I mean, literally, it was the day before a big event, right? And photo opportunities.
Yes.
So you can do this to get event ready.
So what do you commonly recommend, Dr. Rostan, for men to start with?
Well, a lot of the men we see, they've developed a heavy brow, right? A masculine brow is a little flatter and heavier, but with age, that comes down and crowds. There's extra eyelid skin, maybe a little extra mean face if they're really strong in that area. They're not mean. It's just the work of the muscles. So you can do relaxer in that area, like Jeuveau, Latibo, maybe Botox. But for men, I'm doing a lot of Jeuveau and Latibo. These are brand names. It's all the same active ingredient, but they're formulated a little bit different, with a focus on just elevating the brow and softening in between the brow, the 11s, the angry, the mean look. It's a different goal than for women. For women, we're looking for a beautiful, highly arched brow that arches about 2/3 across the brow in the lateral portion. Doesn't spike, but it's a beautiful natural arc. Men don't want that. They have a flat brow, and we can achieve that. Forehead is another area. Most men's forehead can tolerate a good bit of relaxer and look very lovely. Even crow's feet can look nice on men if they're getting a lot of lines around the crow's feet. So relaxer can come into play for men, just like it does for women.
Question. Are their muscles actually stronger than women's muscles?
good
Do they
question.
require more relaxer?
Do men require more relaxer units than women? Typically, yes. And that's why we're using some of those ingredients that I think give a stronger hold. The amount of units we use is really based on activity and muscle size. So the men, is not a bias. You can expect to pay more for your relaxer, but it's by the unit in there. So don't put, even as they're telling me, not too much, not too much. For a gentleman, too much is a whole lot of units. So it's quite natural to have a good number of units there. The other thing we do is restore volume, particularly in the mid face. And some men, even at a young age, in their 20s, lose that deep medial fat pad right under their eye. They go flat on that cheek and look gaunt or hollowed. Now, of course, we do not want to create a puffy, elevated, hydrated cheek like we do in a woman, but there are hyaluronic acid fillers that can go in there and look very natural and lovely.
Yeah.
What we don't do is chase or try to treat a eye hollow, because that anatomically is quite natural. What's happening is the cheek is falling away from the eye. We need to replenish the cheek. In fact, I've removed filler put in from other places when they tried to fix the eye hollow by putting it in the eye hollow. These fillers are reversible. If anything happens, we can dissolve them. The other thing that we treat in terms of volume for men is if they stay very thin, and sometimes just with age, you lose fat in the subcutaneous tissue and the lower cheeks lateral. So you look kind of sucked in cheek, gaunt. A gaunt face is an older looking face. We can use our biostimulatory fillers to enhance the skin and improve a little volume there. Again, it's the thing where it looks like nothing's done, but you just look better.
Is that where they maybe start to notice their jawline's not as strong as it used to be as
A little
well?
sagging.
Yeah.
The jowls.
Right.
Well, that's true. Men maintain a strong jawline typically for a long time, but not everyone. We can also use more bulky hyaluronic filler to recreate a jawline. And a jawline for a man is it's that kind of the anchor of the face. We don't want too much. You want just right, and we can help achieve that with filler. So filler in the medial upper cheek, the lower cheeks if they're real thin or have sun damage, and then reinforcing a jawline. Pretty straightforward. Yep. That's fun. They're doing a lot of that. I try to get a lot of my gentlemen to explore ways to rejuvenate their skin. There's no reason a gentleman can't have bright, refreshed, healthier, less blemished skin. And there's a number of ways we do it. I think one of the most popular ones is probably Tixel, wouldn't you say?
I agree.
Which is a thermomechanical. We say Tixel, and I think we recommend it a lot. Men have kind of thicker, more robust skin. The word we commonly use is more sebaceous skin. Their pores are a little more prominent. And Tixel does just a great job on that type skin, making it look a little smoother, more hydrated, and just better. Now, women love Tixel too, don't get me wrong, including myself. I love it. I just confessed on an earlier podcast that I liked it. And there's no downtime.
It's easy.
It's easy and no numbing. But I won't shame you if you asked for numbing, but no numbing.
No,
we
the
just use
men
the cold
need
air.
numbing their first time around,
I know,
Dr.
but,
Rostan.
yeah, just cold air. All you need is cold air. Tixel's great. The other thing about Tixel is it can be used right over the eyes for some eyelid tightening. And if I've got a blue-eyed and particularly older gentleman, very prone to dry eye syndrome, it's very hard to treat. Tixel treats dry eye and can really turn it around for gentlemen. So that's a very approachable one. I talked to them about the laser facial, the Q switch. They don't seem to have trust in that. Like, if it doesn't hurt or it doesn't do anything, how can it do anything? Well, it does. I promise. It really does. The other thing we recommend a lot of is the non-ablative fractional. And the wavelength would be the 1927. So that's our Ultralaze MD non-ablative fractional. It is FDA approved to treat actinic keratoses, or the little precancers on the skin. It reduces your risk of precancers, which over time will reduce your risk of skin cancers. So using that modality to actually improve the health of your skin. We can combine that with other treatments. We can combine it with photodynamic therapy. It helps the photodynamic therapy agent get in the skin. This is a treatment that is commonly used on the medical side. It is billable by insurance for the treatment of lots of actinic keratoses and actually early superficial skin cancers. So I think that's a really great idea for a gentleman. I think we're seeing more of them doing it.
I agree.
I think the word is getting out. Our medical staff is getting really good at telling our men that come in, this is going to make your skin healthier. It makes me feel better about what I'm doing for the patient. I just love the fact that I'm making their skin healthier, particularly the men that spend a lot of time outdoors.
Correct.
Golfing, tennis, whatever, fishing, beach, you name it.
And we will talk them through and say, this is related to their lifestyle. Yes, you can still play golf. We just need to protect your skin.
Totally. Yeah, you can play golf. Yeah, just get you some good sunblock and a hat. You can still do all those things. The other thing that's common, I don't think the facials really have hit home with men, but if you get one facial, I think you'll be hooked.
I agree.
Totally. And just the way your skin feels, it'll make it easier for you to shave because that skin is more supple, soft, more hydrated.
Yeah.
That's not why I would do it. It's just a benefit. I think I'd do it because you like it. It makes your skin look good.
I agree.
Body contouring, and fitness. Okay. I think a lot of our gentlemen as they age really focus on fitness, which includes cardiovascular fitness, but also resistance training, weight training, core. We have a device here called AccuFit that can enhance that fitness. It's electrical muscle stimulation. It is estimated, I don't know, like 50 workouts in one session. It's very concentrated. It does not compare to home units at all. This is unbelievable. We have done a podcast on it, particularly if you're struggling with an injury.
Right.
And you feel like I can't work out like I used to, or you can't move an arm, or you're recovering from knee surgery. You can focus on that muscle group to help it recover and get you back to your routine more quickly. I think the frustration for men and women alike is after, it doesn't even have to be a major injury. Just, like I'm out of shape because my back hurts, and I love the AccuFit because it's helping me. So those little things, my shoulder's hurting and I can't lift weights. The AccuFit can help keep you engaged and keep your core strong so that when you do get back to working out, you're doing it in a safe manner and in an appropriate manner. So I think that's popular. We offer cool sculpting as well as Bliss, which is a laser for fat reduction, unwanted fat, not big areas, but very helpful. These are areas we really don't want to liposuction because they're too small. Or
Right.
The Bliss can be good. That's a 1064 laser because of the way it contours on the body. So cool sculpting, you have to grab like a love handle or something, but the Bliss, we can kind of put it on the skin, and into some contours it actually works better, but all these are non-invasive ways to reduce small areas of unwanted fat.
Right.
That's popular with both sexes, but I think with the men.
Totally.
And maybe you don't see it as much as I do. I see it with the medical staff, is hair.
Oh, yes.
Hair is having a moment. Hair is big, and I love it. But hair had a moment for me several years ago. I made a commitment to treat patients with hair loss, particularly I was very troubled by a young woman that came in who had severe or extreme, strong. I don't think the oncologist would like me calling it that. She had a heavy routine of chemotherapy for advanced breast cancer. And they're going to be more aggressive with her because she's young. So she lost her hair, but it didn't grow back completely. And in some areas, didn't grow back at all. And this is a reality. And it really made me dig deep into what we can do to help the hair grow. And what I've learned over several years of aggressively treating hair loss is we can grow hair. We can offer hope. Yeah. We can grow hair. We can sustain the hair you have. It's fantastic. I think I get a little more passionate about it for women because women think there's nothing they can do. Men have been aware there's things they can do. but we're seeing a lot more men for that. And we've got such nice things to offer. We're offering, of course, the 5-alpha reductase inhibitors, dutasteride and finasteride, which are a little enveloped in controversy about sexual side effects and depression. But I have plenty of men on them that are doing great. Low-dose oral minoxidil just grows hair. Topical minoxidil, compounded topical products too. Home treatments you can do, supplements. Our favorites are Viviscal Pro and Extra Say gummies. Tend to recommend that more for the women because women grow their hair for a long hair cycle, whereas men tend to cut it. So with men, I'm more driving a shorter cycle. But the newest thing is, and we've done PRP for years, but the newest thing is exosomes. And so now in my clinic, if you're over the age of 25, we're going to recommend an exosome treatment. These are not injections. I mentioned PRP, those are injections. That is FDA approved for injections. Exosomes are not, but we can use them on the skin. So we do a little device treatment. One device we use is one we've used in this clinic for years called Carolase. It's that fractional 1927 laser, Ultralase MD, but they developed a special tip that goes through the hair. Have you seen it in action? It's really cool, but it's goes through the hair.
I have.
Yeah, it's fun to watch. I have been aware that the 1927 grew hair for years, but I didn't fool with it because we just had those rollers. I'm like, I can't roll through someone's hair.
Right.
But now we have this nice tip that just leads the way through the hair. And boy, that Carolase grows hair. It's phenomenal. It's not long-term sustainable. You got to maintain it with other stuff. But the other thing the 1927 Carolase does is increase the permeability of the skin. So now we can put topicals on the skin and they get in better. So I've got a vial of highly concentrated exosomes. I'm not going to rub on intact skin, but I will rub on skin that we've treated with a laser for one, and in the scalp, that's going to be the Carolase, and it gets in better. Or we have a device called Juvasonic. It creates little cavitation channels. They're not there long, but while they're there, we can use it to drive in the exosomes into the skin. Okay, so just topical. You can go home with a topical copper peptide substance.
I think we have it here.
That helps it grow. Yep,
Yeah.
that's it. And you can maintain with the plan that we've come up with for you. Exosomes in the scalp with Juvasonic and the Carolase is relatively new to this practice. We're seeing some, results back after like 1 or 2 treatments. I will share my enthusiasm, but I will follow up with long-term results. It's unbelievable. The hair growing.
I love it.
I would never expect hair, we tell you it's going to take 3-6 months. Let's not hold our breath. It's going to take a while. It's growing hair. We saw recently 2 gentlemen, and they had kind of fairly bare areas in their coronal scalp. So I could really see it. We take good photos so we could see. I mean, it's crazy the amount of growth. Now, this is a small number, listeners, and viewers. I'm speaking on a small number. I hope to speak with you again and follow up on larger numbers, but I will just go ahead and share my enthusiasm about it. I'm seeing great results. In a woman, I have a woman who had very advanced hair loss on the top. Very. Like you could see so much skin, but we've been treating her and we get this wispy hair growing. So we offered her the exosomes. So she had 2 treatments. I mean, she is growing thick black hair in up here. She's tickled pink. So I've described to you an N of 4 patients that I have, that will more to come, but that's what's new, and I'm excited about that. You can also use exosomes on your skin for renewal when you pair it with the same lasers that we do on the scalp. So the Ultralase non-ablative fractional 1927, the Tixel, even ablative fractional, you can put on this ablative fractional. How about that for men?
Oh man, they feel,
It's so good.
They feel so good after
I know.
that.
Okay, so there's non-ablative fractional and ablative fractional, right? So non-ablative is what I had yesterday. So in the right light, you might see a little bit of redness. If you look close, you'll see some marks, but it's nothing oozing or draining. I've got some powder on and tinted sunblock. That's not falling off my face. Ablative is it creates little microscopic channels in the skin. They close up in 48 hours, but you might feel a little oozy or moist. We have one that's highly customizable. It's a fractional erbium. We can go real superficial, and then it's almost just a dusty. It's really, you're not very oozy. Or in areas of deep wrinkles or acne scars, we can go deep, and then you're going to have more swelling and redness. So this is troubling for women. They get red and they swell. They have, 36 hours of that?
Right.
You can carve it out of your schedule, and they do fine. Men, it's like nothing happened.
I know.
It is like nothing happened. Why? Their skin is thicker, number one. Number two, they have prominent hair follicles over a vast majority of their face. The skin renews up those hair follicles, and poof, you're healed. So, we love Ultra Clear
We do.
for men.
And we have a lot of male patients.
Yeah, and they come back for more. I promise they come back for more.
Even when they say it's painful, they still come back. And we are extremely enthusiastic about it. It's fun.
It's nice. And again, that's the treatment. That's another treatment that'll make your skin healthier. I like it because it's ablative. If we throw in the little deeper layer, there is a study that has shown it significantly reduces your risk of skin cancer in the future. That study was done on the arms and people really prone to skin cancer. So, but as physicians, we take the information from these studies and apply what we think is going on to other areas like a face or a neck.
Right.
More to come on that about skin cancer, but I'd like to spread the word about that. You don't have to come in for rejuvenating treatment. You can come in for skin cancer prevention treatment, right?
Exactly.
Yeah.
I think that
Men do need a little nudge, don't they?
they do.
What kind of nudge do you give them?
Dr. Rostan will
I'm kind
walk
of a
out
bully.
of the room and they'll say, now, what does any of that mean? And I'm like, just sit there. I'm going to deliver it all to you. We have a plan. We keep it simple. It sounds like a lot. It does. But all of these treatments, even for your body, can happen in one appointment.
Oh, totally. Layer them up.
Layer them up. So we do keep it simple. They just need to be told what to do. It's okay. We boss them around. We're
Alexa
bossy.
said it, not me. Alexa
I
said
am
it.
bossy.
Yeah.
But they're really happy afterwards, and they feel more confident
I
in
do
themselves.
think with men, there is a higher level of trust in our plan. It might be because they're not Instagramming and looking at 80,000 videos of other people doing crazy stuff on their skin. Men are more readily accepting of us as the expert.
I agree.
And if we communicate well and find something they're comfortable with, then they're
I
on.
agree.
They sign up.
They do.
And they do great. Did I say that? They do great.
Yes.
Yes, there's like no phone calls. There's no nothing. All right, men. What else about men? What are we achieving? Okay, let's think about some of the men that come in and they've done some treatments. They've done a little Botox, maybe a little bit of filler, done some relaxer, filler, maybe some laser, and they come back. What's the transformation we see? I think they're just sunnier and they look great, and I just think they're sunnier, and I actually think they're happier. And I think the reason they're happier is somewhere we achieve their goal for them to fit more appropriately in the workplace, feel like they're closer to the young men they're being asked to mentor and lead, and less like the old guy in the office. And nothing about them looks different than what they were. They still look just like themselves, just fresher, brighter, better, healthier, younger. Vital? More vital?
I agree. And maybe they're getting more compliments from their spouse or partners.
Could be.
That could be another added benefit.
Can be.
Dr. Austin bullies Robert about doing treatments.
Yeah, maybe I do. Yeah. Mr. Austin does vascular laser
Sorry.
treatments.
Yeah.
Yeah. And vascular laser treatments treat blood vessels in the face, and he doesn't like the blood vessels. I'm reassured about that too, because a study came out recently. It's a small study, retrospective chart review of some patients in a cosmetic clinic. And those patients that had a vascular laser, which is a laser that treats blood vessels, had a statistically significant reduced risk of skin cancer. I mean, and this is a wow, because the other study I was quoting was a VA clinic, and the population was older, and they took it from individuals that had a number of skin cancers already. This is a cosmetic clinic where I would presume they're getting good advice and taking good care of their skin.
Right.
So to have that differentiation, if you come into my clinic now and you're surprised that I recommend a vascular laser more readily, it is related to this apparent reduced risk of skin cancer. And I want that for everyone. It's devastating to have your nose or cheek worked on. It's not the end of the world, but it's just, if we can avoid it, it'd be so great.
Right.
So great.
I do think, Dr. Rostan, you focus on advanced treatments for men as well, that we don't see every day, but rhinophyma, eyelid surgery.
Yeah. Yeah. So next stage, up there, not everyone that comes in here looks like your typical cosmetic client. We do treat rhinophyma, which is overgrowth of oil glands on the nose, distorting the nose. So that can be treated. We do eyelid surgery, which is a quick and easy surgery for men, blepharoplasty, upper and lower. I don't do any other eyelid surgery. If you need a brow lift, I have to refer out. But it's a simple skin excision of the upper layer of the upper eyelid. So the excess skin is carefully taken out with a laser, and we just put stitches in. Very easy. The lower eyelid surgery is removing the excess fat pad. We've even done neck lipo on men
Right.
to help define the chin. Another thing they heal up quickly from that would make them the envy of women. That's kind of next step, and they're out there too. Men want to avoid a facelift, and the main reason is it looks like you had a facelift. Nothing wrong with it, and you can see the scars in a man more readily than women. Men, you can get a facelift and look great, and we make those referrals, but I find that many men wish to do whatever they can to avoid a facelift. So non-invasive tightening, the RF microneedling, the Xless device, and even threads are done in men. So next level can be done as well. And the idea is just helping you look your best, but in your comfort zone.
Right.
Where they feel like, I really haven't done much of anything, but I'm just maintaining. I look
Exactly.
great. Some men, their comfort zone is getting a facelift. We can help facilitate that referral for sure. And we can help you have good-looking skin after a facelift or neck
yeah.
lift.
Or before.
The other thing that we don't offer for men is hair transplantation. I was trained in it, so I know about it, but never offered it. We refer out.
Oh, you were?
Mm-hmm.
That's really neat.
But I'm trying to recruit a physician that might be interested in it. It plays well with the non-surgical hair restoration. You can't just go get a hair transplant and not do anything else. You've got to keep the hair growth around the transplanted areas, and it looks great. So even if I make a referral out, the gentlemen still come back here for maintaining non-surgical and medical care for their hair. And it also works great in women. This podcast is about men. So that is something that we refer out, but we can certainly get men ready for their hair transplant by maintaining the hair that they have.
And I think it's important to note, jumping back, is we see men of all ages, even as early in their mid-20s, that are coming in to start rejuvenating their skin.
We do. We certainly see men coming in, their acne scars have been bothering them for a long time, and now they're employed and they've got a little money and they want to work on it. Or the mild changes of aging as they move through their 20s is now making their acne scars look more prominent, and it's time to address the aging and the acne scars.
Right.
So
Yeah.
that's right. I like seeing these young men.
It's fun.
Yes.
They're starting new roles in their job and or graduating from college.
Very nice.
It's nice.
So in this podcast, I hope we've answered some of your questions about the procedures that men can do and are doing, and addressed some of the concerns that our male listeners may have about how we approach and take care of gentlemen here at Charlotte Skin and Laser. As I think you can tell, we love treating men because all of them do just great. It just looks great. It's easy. I like easy. It's easy and it's rewarding. It's
Well, you don't
rewarding
make
for
it
me.
sound easy all the time.
No, probably not. Probably not. It's rewarding for me, and I think it's rewarding for our patients. So welcome comments and questions. Probably a lot more we could talk about, but enjoyed the chat today. And thank you, Alexxa, for your both your expertise, but your insights. And Alexxa does an excellent consultation. And if you do want to come in for a consultation, I think you'd enjoy meeting with Alexxa. And we look forward to tuning in with you again on our next episode of Queen City Skin Podcast. Enjoy.
Enjoy.
Thank you.
Thank you.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.